Worried about scarring and natural look if I have eyelid surgery. I'd like to have surgery to reduce saggy eyelids and the look of tiredness. I'm very fair-skinned and I'm worried about scarring. I had breast reduction 10 years ago and I have some keloid scarring. Will I be more prone to scar? And if so, is there something I could do post-op to help myself achieve less scarring? Also, any recommendations for plastic surgeons in either Minneapolis or Scottsdale, Arizona? I want a very natural look with no brow lift, just the upper-lower lids. Thank you.
Thank you for your question and for submitting the photos, which are very helpful. I understand that as someone with fair skin and having had previous breast surgery, that you are concerned about scarring. Well, let's just first understand something. In our practice, we do a fair amount of breast surgery. We do breast augmentations, which we do through the armpit, it's called transaxillary approach, and we do pretty much local anesthesia, light sedation, breast lifting, which is typically incisions around the nipple and vertical incisions along the breast. Now, there's a real difference in the way the skin on the chest heals versus the skin on the face. The face is actually much more forgiving in terms of its natural, what's called physiology, because of a concentration of oil glands that are necessary for healing. But even that particular fact is not necessarily relevant to eyelid surgery. In 20 years of practicing and treating people of all kinds of ethnic backgrounds, I actually wrote an article years ago called Ethnic Considerations in Eyelid Surgery. I can share with you that light-skinned people with your skin type, which is very light, tend to have very, very nice healing. And in terms of the scarring, the incision lines can be done in such a way that it's almost imperceptible. A lot of hairdressers in my area in Manhattan and Garden City like to refer to me because they like the way I do my lines. And that's the art. You see, when you're taking away extra skin in the upper eyelids, there are so many ways to do it in terms of the pattern that is drawn and how, in terms of the technical aspects of removing the skin, doing whatever deeper structural procedures you need to do, whether it's removal of fat, whether it's adjusting a muscle, all those little subtleties, and of course the closure. And so all of these things are part of the ideal approach of getting the best result possible. So understanding that, first of all, getting just with your skin type alone, there's a lot of room for flexibility, in that even if you don't get the best procedure possible in terms of closure, it's still likely you'll heal pretty nicely. So you don't have to necessarily transfer your experience with the breast surgery to the eyelid area. In fact, I've had many, many patients who are of African origin who have a tendency to form keloids, and these are legitimate keloid formers. In other words, like if they get their ears pierced, they get a giant ball behind the ear. That's a real keloid. And when I've done eyelid surgery, they've healed with no problem at all. So I think for your, as you do your research, that you need to identify, after doing some consultations, and a very experienced and artistic specialist who performs a lot of eyelid surgery, and just look at their results, and if you are able to maybe even meet someone who's had a procedure by them, and you can get a sense of what kind of design and approach the doctor uses. And the devil is in the details, and understanding that it takes ideally the perfect combination of a nice plan of how much skin to remove, where to place the crease, how the actual design is drawn, and then all of the steps beyond that, all the way to the closure, to the aftercare. Every last step makes a difference, and so that's something that I have certainly have a lot of experience with, and so I can share that experience with you. So I recommend that you meet with several experienced cosmetic surgeons who do a lot of eyelid surgery and learn about the details of their approach and get a sense of how what their results are and how their healing process appears to be, whether it's on photos or with a live individual. So I hope that was helpful, and thank you for your question.